I welcome you all to the Healthy Heart, Healthy Life Pune, session 18. I'm Dr. Neelkant Karandikar, senior cardiologist from Pune. I do cardiac consultations and non-invasive tests like stress test, echocardiography at the Alpha Diagnostic Center, Tirak Road. I also see patients at Heart Clinic, Mukund Nagar, and Raghav Diagnostic Center, Jangli Maharaj Road. Interventional cardiology procedures like angiography, angioplasty, pacemakers, etc. I do at the Ruby Hall Clinic, Sahyadri Hospital, and the Ranath Mangeshkar Hospital, Pune. I am the professor emeritus in cardiology and also the first gold medalist of the Bombay, now Mumbai University. Recently, the World Hypertension Day was there on May 17th, which is very recent, May 17, 2026. And this prompted me to think that why not have a session on hypertension? And why hypertension is so very important, we are going to see. The World Hypertension Day was celebrated on 17th of May, and the theme of this World Hypertension Day was controlling hypertension together. That means yourself, myself as a cardiologist, together we make an effort to control this silent killer. Check your blood pressure regularly and defeat the silent killer. Was announced by the World Hypertension League and World Health Organization on 17th of May, the World Hypertension Day. The campaign highlights the importance of regular blood pressure checks, which you should do every 6 months. If you are below 50 and your blood pressure has been once recorded as normal, there should be accurate monitoring with a good blood pressure instrument. Healthy lifestyle is important with reduced salt intake and community awareness to fight hypertension, which affects nearly 1.4 billion people worldwide. If somebody asked you a question, you have yet not suffered from a CV event, well, you should be saying, no, I have not suffered. And why have you not suffered? The reason could be that you're away from the risk factors, mainly the modifiable risk factors, of which the number one is high blood pressure. There are non-modifiable risk factors like age, gender, genetic factors, race, etc., which we cannot do anything about. But the modified risk factors, we can definitely do something about. And the number one is high blood pressure. Let us look at the results of the Global Burden of Disease study, which was started in 1990. And they assess the global risk factors and which are the top 10 ranked risk factors. Number one today is hypertension in 2026. Now, this table shows the rank in 1990, which was 7th rank. It rose to first rank in 2019, and even now it is ranked number one. The burden of hypertension in India, let us look at that. About 33% of urban and 25% of rural Indians, means 33% of those who live in cities and 25% of those who live in the villages have hypertension. Only 25% of rural and 38% of urban Indians are being treated for hypertension, that is high blood pressure. Only 1/10 of rural and 1/5 of urban Indian hypertensive population have their BP under control. So there is a really a need to do something about this, the silent killer, and something, a risk factor which is there in 1/3 of the adult population, and it is not being controlled properly, we definitely have to do something about it. Here is a chart which first of all says that 1 in 2 patients with diabetes also suffer from hypertension. So the first thing I would like to stress on that if you have diabetes, also check whether you have high blood pressure. It is very common. 50% of diabetic patients have high blood pressure. This chart, this figure shows the prevalence of hypertension. Maximum it is shown in Himachal Pradesh, and Maharashtra is yellow. That is something, in the middle level. The prevalence is there. The global scenario in 2021 about hypertension. Hypertension is the leading cause of cardiovascular death. More than 1.28 million billion adults suffer from hypertension. Now it is 1.4 billion, the figure. 42% are diagnosed and treated, but only 21% have BP control. So the problem is worldwide. Not detecting properly or adequately and not being treated adequately is the story of high blood pressure or hypertension. Now let us look at another concept which was brought in by the GBD or Global Burden of Disease Study. Disability Adjusted Life Years, or DALI as a short form. This takes into account years of life lost due to premature death. That means suppose a person, an Indian, the lifespan is 70, let us say, on an average, and if he dies at 60, 10 years of life have been lost because of premature death. Also, those years of life lived with disability are also counted in DALI. For example, somebody who would have who has lived or who would live up to age of 70, at the age of 60 he develops a severe stroke and cannot work, then those years which he lives with the disability of stroke, that is 60 to 70 years, is also included in the DALI. So, DALI takes into account premature death as well as years of life lived with disability. Both together signify years of healthy life lost. Now let us see the worldwide data about DALI. The maximum DALI is because of hypertension. Maximum years lost of human life either because of premature death or because of disability is because of high blood pressure. Then comes particulate matter pollution, high body mass index or obesity, maximum high fasting blood glucose as happens in diabetes, smoking, diet high in sodium, LDL high, kidney dysfunction, diet low in fruits, diet high in red meat, alcohol disuse, low temperature, lead exposure, secondhand smoke, diet low in vegetables, diet low in whole grains, low physical activity, and high temperature. So all these are factors which reduce the DALI. Number one is hypertension. Now let us look at the estimate that has been predicted in 2050, that is about 24 years from now. The ranking of age standardized DALI attributed to cardiovascular risk factors. The number one risk factor is again high blood pressure. And we are part of South Asia. Here it is number one. And all the other parts of the world also, hypertension or high blood pressure is number one. That is the importance of high blood pressure, which we have started discussing today. And this discussion will go on for a few sessions. What is blood pressure? Blood pressure is the pressure exerted on the walls of the arteries by the blood after it is ejected by the beating heart. This is the beating heart, and as you can see, the left ventricle the blood is shown in the red. It is a purified blood. It is pumped out and it goes to the head, uh, upper limbs, heart, arterioles and capillaries of the body, in the lower limbs also. And this blood exerts pressure on the wall of the arteries as it is shown here, and that is the what we call as blood pressure. The artery, pulmonary artery, which comes out from the right side of the heart and goes to the lungs, this pulmonary artery, here also blood exerts pressure on the walls of the arteries, but it is much less. The average or the usual pressure in the systemic arteries, that is called, is 120/80, where in the pulmonary arteries it is around 125 or 50/15. Blood pressure refers to the pressure the blood exerts within the arteries. Contraction of the heart muscle is primary determinant of blood pressure. Blood pressure is indicated by two numbers. The first or top number in blood pressure readings is the systolic pressure, as it is called, systolic BP. It refers to the pressure in the arteries when the heart contracts. The second or the bottom number of blood pressure is the diastolic pressure or diastolic BP, as it is called. It refers to the pressure in the arteries when the heart is at rest between the beats. Blood pressure is measured with a sphygmomanometer or the BP instrument or blood pressure cuff. Blood pressure that is too high is called hypertension. Blood pressure that is too low is called hypotension. Now let us see the concept of systolic and diastolic blood pressure. When the heart contracts, blood is ejected into this aorta, which is the major artery of the heart, and the blood pressure rises to say 120 or around that or even more. But when the heart stops contracting, the mitral valve opens and the aortic valve closes. The blood does not go back to the heart. It is prevented from going back to the heart by this aortic wall. And whatever the blood remains in the aorta exerts the pressure on the wall of the artery, and that is called diastolic pressure, diastolic blood pressure. So when the heart contracts, systolic pressure. When the heart relaxes, diastolic pressure. So blood pressure, if it is, usually the doctor will write 120/80 millimeters of mercury, because we'll be seeing in the next session what are the instruments used to measure the blood pressure. Or he will write 120/80 mmHg, which is the short form for millimeters of mercury. So this is the systolic pressure and this is the diastolic pressure. You will ask me, when the heart relaxes, the pressure in the heart comes back to zero. Now, why does the pressure in the aorta not come back to zero? Why does it remain 80? That is because the aortic valve closes and prevents the return of blood to the heart. That is why some pressure remains here, and that is called the diastolic blood pressure. Thank you very much. We have just seen the very basics of hypertension, what is blood pressure, what is systolic, what is diastolic, what are the statistics in the world and in India regarding the incidence, prevalence of blood pressure. But thank you for this watching this session. And I'm sure you must have subscribed to my channel. If you have not subscribed, I would request you to certainly subscribe to my channel. Tell about this channel to your friends, acquaintances, and relatives. And also give me a thumbs up so that I feel encouraged to bring to you more and more important information about the heart. We have started this very important series on blood pressure, and we will continue for a few sessions on this very, very important topic. Thank you very much again. See you next time.